Hi everyone, welcome to SK Med Concept. So today we are going to discuss some more questions from biochemistry base paper. So let's get started. Okay, so the first question, the condition of a child is very languid because his liver is enlarged and liver biopsy revealed excess of glycogen. And also there is a case seen that glucose concentration in blood is below normal. So what is the cause of this condition? So this is a question we have to deal with. So first of all, from the question itself we have got a clue that there is excess or there is accumulation of glycogen in his body and there is less glucose concentration in the body as well, right? So from this we get a clue that something is disrupted which converts glycogen into glucose. So a metabolic disorder occurred which delayed the conversion or which is disrupting the conversion of glycogen into glucose. So what is this process known as converting glycogen into glucose? That is known as glycogenolysis. So in fact, glycogenolysis means glycogen is lysed to form glucose. So this happens with the help of an enzyme called glycogen phosphorylase. To the right side of this video you can see a chart in which it shows the conversion. You can see that glycogen is actually converted into limit dextrin and the following compounds with the help of glycogen phosphorylase from the beginning, right? So if this enzyme is badly affected or if there is a deficient of glycogen phosphorylase, what happens? Glycogen is not converted into glucose. So in such case, we can get an accumulation of glycogen and also less concentration of glucose. So now I hope this question is very much clear, because if there is an absence or less activity of glycogen phosphorylase in liver, the conversion doesn't occur and glucose concentration goes below and glycogen is accumulated. Okay, the next question, the patient suffers from high activity of LDH1 to aspartate aminotransferase, creatine phosphokinase. Okay, so all these are enzymes. So they are asking about if these enzymes are increased in the body, what organ is affected. So first of all, you have to keep in mind enzymes is a very important topic because you can get many similar questions. Secondly, always keep this graph in mind, because here in the figure you can see that it shows an enzyme pattern in myocardial infarction. So whenever myocardial infarction happens in our body, there are certain enzymes which increase in our body. So the first enzyme to rise in our body is creatine phosphokinase, and that too creatine phosphokinase is having different isoenzymes form, but not as LDH. It has only 3 isoforms, but LDH has 5 isoenzymes, right? So creatine phosphokinase will be the first enzyme to be released into blood, and then the second one will be aspartate transaminase, and the last one will be lactate dehydrogenase. So this is the enzymatic pattern whenever myocardial infarction occurs. So now you can clearly answer this question. LDH1, 2, aspartate and creatine phosphokinase, it is seen in case of myocardial infarction. So this is actually a figure showing the summary of diagnostic markers in which we can identify from the blood test, and according to the enzymes which are risen in our body, we can identify which enzyme causes and what is the cause of this enzyme to rise. So this is particularly for acute myocardial infarction. Moving on. During metabolic process, active forms of oxygen including superoxide anion radical are formed in the human body. So what enzyme anion is activated? Okay, first of all, when we are talking about free radicals are actually not good for our body. It can damage our cells. So but then free radicals can be converted into hydrogen peroxide with the help of an enzyme called superoxide dismutase. Okay, so this enzyme converts free radicals into hydrogen peroxide. Hydrogen peroxide can also be further converted with glutathione, peroxidase and catalase. But here the question is all about superoxide anion radical is formed. So what enzyme can actually convert it, or with the help of what enzyme is this anion activated? So obviously from the figure itself you can say that it's superoxide dismutase. And catalase, you can see where catalase comes into option and where glutathione peroxidase are coming. It's all very much clear in the figure itself. Moving on. Examination of a patient revealed typical presentations of collagenosis. This pathology is characterized by the increase of the following urine index. Okay. First of all, what do you mean by collagenosis? Collagenosis is actually a group of diseases in which the connective tissue in our body is affected. So, in part 1 of discussion, we already learned about collagenosis. I hope you remember the hydroxylation of proline and lysine with the help of vitamin C, which will help in the formation of collagen. So, this is all very much common to us. We are not to this fact. So, suppose if there is extra degeneration of collagen, okay, so what do you from the previous discussion, what do you think, what will be seen in urine? Obviously hydroxyl proline will be seen, because due to the hydroxylation of proline and lysine only collagen is formed, right? So obviously if there is more degradation of collagen, hydroxyproline will be appearing in urine. Okay, now the next question. A 46-year-old female has history of muscular dystrophy. Which enzyme changes are diagnostic? Okay, again I am repeating, enzymes and vitamins are very important topics in biochemistry, Krok. Okay, so again the case is of a muscular dystrophy. So just like in myocardial infarction, in muscular dystrophy also a group of enzymes are increased. So these enzymes are actually creatine phosphokinase, aldolase and aspartate transaminase. So particularly when speaking, the first enzyme you can see is creatine phosphokinase. But I already mentioned that creatine phosphokinase is having 3 isoforms. What are the isoforms? K1, K2, K3. Okay, CPK1, CPK2, CPK3. And here to the figure you can see that we mentioned the subunits like BB, MB and MM. We name it according to the tissue of origin. So here itself the last isoform, isoenzyme CPK3MM is actually the tissue of origin is skeletal muscle. So if there is a functional disloss or if there is any issue with the muscular system or skeletal muscles, obviously this enzyme will be seen more in our blood. So again, always keep these enzymes of myocardial infarction, muscular dystrophy and liver enzymes in mind. So it will help you a lot. Okay, next one, examination of a patient suffering from frequent hemorrhages in the inner organs and mucous membranes revealed proline and lysine being included in collagen fibers. Impairment of their hydroxylation is caused by the lack of enzyme, okay, lack of vitamin. Again, this is a repetition. From the first part of the discussion, we already learned that hydroxylation of proline and lysine in presence of vitamin C is essential for the formation of collagen. So this is again a repetition. Products of some proteins, hydrolysis and modification are biologically active substances called hormones. Okay, lipotrophin, corticotrophin, melanotrophin and endorphins are synthesized in the hypophysis of following. Okay, so they are particularly asking from where are these hormones synthesized. Okay, lipotrophin, corticotrophin, melanotrophin and all. So first of all, you have to keep in mind about the anterior pituitary hormones and the posterior pituitary hormones. So basically posterior pituitary is not producing any hormone, they are only storing. And we know that oxytocin and vasopressin are the two hormones we get from posterior. But what about anterior pituitary hormones? Anterior pituitary hormones can be divided into 3 groups. The growth hormone prolactin group, the glycoprotein hormones and pro-opiomelanocorticopeptide family. So in the last family of POMC peptide family, this family is actually consisting of many hormones like ACTH, lipotrophin, melanocyte stimulating hormone and several neuromodulators like endorphins, enkephalins, which are modifying the pain, okay, pain modulators. So these are the enzymes which come under POMC peptide family. So this is also a direct question. If we know the family of hormones, you can easily answer this. Okay, so next one. A 48-year-old patient complained about intense pain, slight swelling, and reddening of skin over the joint. Temperature rise up to 38 degrees Celsius. Blood analysis revealed a high concentration of urates. Okay, so this condition is caused by disturbed metabolism of what component? First of all, there is a clue in question that there is reddening of skin over joints and also the high concentration of urates in blood. So this condition is seen in the case of gout. So gout is actually a metabolic disorder in which there is overproduction of uric acid. So this uric acid, when there is severe overproduction of uric acid, it will deposit in soft tissues, especially in joints. Then the joints will get inflamed and will cause some painful gouty arthritis. So this is the pathology in gout. But what actually leads to this? We have to know one point, that uric acid is the end product of purine metabolism. So whenever there is a metabolism of purines occur, uric acid is the ultimate product. So if there is any disorder in purine metabolism, there is a chance that uric acid can increase. Okay, so this is the reason why there is more production of uric acid resulting in gout. So we can answer it is due to a disturbed metabolism of purines. And to the right side you can see a small box. There you can see the compound structure of uric acid, and uric acid himself is saying that I am the end product of purines. An increase in my production causes gout. Inflammation of joints is the symptom, and administration of allopurinol is a relief. So this is what uric acid speaks about himself. Okay, let's moving on. Patient experienced increased susceptibility of the skin to the sunlight. His urine after some time became dark red. Okay, so what is the cause? So first of all, the point you have to notice, the urine becomes dark red, and secondly, reduced sensitivity or more hypersensitivity to sunlight. So there are particular disorders called porphyrias. These are actually metabolic disorders which are affecting heme synthesis. So this kind of disorder will always cause increased excretion of porphyrins or porphyrin precursors from our body. So one of the symptoms we can see in porphyrias is the urine becomes dark red or gets darkened on exposure to air. It is due to the conversion of certain components. Okay, so keeping it very simple, we can say that porphyrias are metabolic disorders which will cause increased or hypersensitivity to sunlight, and urine gets darkened out. These are the common symptoms, and I think we have discussed porphyrias more clearly on the first part, where we already discussed about erythropoietic porphyria, congenital porphyria, and all the different varieties. Okay, moving on. The formation of a secondary mediator is obligatory in membrane intracellular mechanism of hormone action. Point out the substance that is unable to be a secondary mediator. Okay, so here we are talking about secondary mediators, and now we have to find out from the option which is not a secondary mediator. So first of all, you have to have a basic idea that hormones can be classified into two groups, group 1 and group 2. The group 1 hormones will directly bind to intracellular receptors. What do you mean by intracellular receptors? The receptors which are present inside the cell. So there they will form receptor hormone complexes, and this complex is responsible for causing biochemical functions. This is only in case of group 1 hormones. But what happens with the group 2 hormones? They will bind to cell surface receptors. That means the receptors which are present on cell surface. And then they will cause the release of some molecules. These molecules are actually known as second messengers. Now the second messengers will be responsible for performing the biochemical functions. So always, most of the case with the second messengers we can see are cyclic AMP, phosphatidyl inositol, calcium diacylglycerol. All these are second messengers. And from the option, if we go back to option, CAMP is there. Okay, we know that it is a second messenger. Diacylglycerol, of course, it is a second messenger. Inositol, 3,4,5 triphosphate. Okay, phosphatidyl inositol is also a second messenger. Calcium is also a second messenger. So which is the one which is left out? Glycerol. Glycerol is not a second messenger. So this is a basic for this. Okay, next one, Carnitine, including drug, was recommended to the sportsman for improving results. What process is activated with the help of carnitine? Okay, so before learning about carnitine, you have to have a basic idea about fatty oxidation or beta oxidation of fatty acids. So what do you mean by beta oxidation? It is nothing but oxidation of fatty acids in beta carbon atom. Okay, so what is actually happening in beta oxidation of fatty acids is, first of all, fatty acids will be activated. Then they are actually present in cytosol. Okay, then the activated fatty acids should be transported into mitochondria, and then comes the beta oxidation reactions. So these are the three steps what is actually happening in beta oxidation. So here you can see activation of fatty acids, it happens in cytosol or cytoplasm with the help of enzyme acyl coenzyme A synthase or thiokinase. Okay, and but then what happens with the transport of acyl coenzyme A into mitochondria? See, long chain fatty acids, they cannot enter into mitochondrial membrane directly. So they want some shuttles which will help in the transport. So these are actually known as carnitine. So carnitine are actually carriers. They are carriers which carry fatty acids into mitochondria. Okay, and then here you can see the steps of transport of fatty acids are not much important for Krok because there are different varieties of carnitine acyl transferase 1, 2, all those. But it's very good to know for your knowledge there are different varieties of carnitine acyl transferase. Okay, and to the final end you can see that these are the reactions which happen. So summarizing, keep in mind beta oxidation of fatty acids. First of all, it happens by three steps. First one, activation. Second one, the transport of fatty acids into mitochondria with the help of carnitine. So that is why the sportsmen were given carnitine containing drugs, so that carnitine will help in the transfer of fatty acids into mitochondria. Okay, next one, a patient has been diagnosed with Alkaptonuria. Choose an enzyme whose deficiency can be the reason for this pathology. Okay, so Alkaptonuria, first of all, keep in mind it is an autosomal recessive disorder and it happens due to homogendocyte oxidase deficiency. So this is the enzyme which is responsible for this pathology. So how does this enzyme came into place? Let's see. Phenylalanine is first converted into tyrosine and then into hydroxyphenyl pyruvate and then finally into homogendocyte. But this homogendocyte, if homogendocyte oxidase enzyme is present, it will be further converted into mallyl acetoacetate. But what happens is, in some people this homogendocyte oxidase enzyme will be absent. So what happens? Homogendocyte, or we can say homogendosic acid, will accumulate and they will accumulate and polymerize to form alkapton bodies. So this is the base of this Alkaptonuria disease. Okay, and usually it is presenting in normal life till third or fourth decade, and here also we can see the condition of urine darkens on standing, and that is only manifestation in children. And this Alkaptonuria is actually an enzyme deficient disorder. Okay, so particularly no mental retardation is seen. So there are some questions which will be asked, like, is mental retardation seen in Alkaptonuria? So keep in mind mental retardation is not seen in Alkaptonuria. And then finally you can see some laboratory diagnosis which will help us determining Alkaptonuria. Okay, and then utilization of arachidonic acid via cyclooxygenase pathway results in formation of some bioactive substances. Name them. Okay, so before moving into this, you have to keep in mind membrane phospholipids, right? The phospholipids which are present in our cell membrane. When phospholipase A2 enzyme will act on it, arachidonic acid is released. This arachidonic acid can choose two pathway. So cyclooxygenase pathway and lipooxygenase pathway. So if it is choosing COX pathway, what happened? Prostaglandins and related substances are formed. And if it is choosing LOX pathway, leukotrienes and related substances are formed. So this is the base. Okay, and this prostaglandins, everything we will discuss again when we are discussing pharmacology of prostaglandins. Okay, So now back to our question. They are asking what are the substances produced. Obviously it is prostaglandins, because prostaglandins are produced from Cox pathway of arachidonic acid. That's all for today. We will see in new video with a new topic. Thank you.